as it gets ready to roll them out next week. Our next guest is questioning some of the CDC's data. Well, joining us now is Chief Innovation Officer and Associate Medical Director for Work Care, Dr. Anthony Harris. Dr. Harris, welcome to the show.
Thanks so much, Lindsay. Thanks for having me.
So what specifically are you questioning about the data that the CDC is putting forth?
Sure, I'm questioning whether every American needs a booster, right? And I'm questioning whether or not we're looking at the evidence around who may be immune and who's not. I mean, if we don't have to give everyone in the U.S. a booster, why are we pushing that? And, you know, it's not to say some people don't need it. I'm not knocking that. But if we can see and understand who needs it and who doesn't to keep them safe, that's the path we should be going down versus mandating everyone have a booster, perhaps.
You know what's interesting is that when the White House started talking about this, I just assumed, and bad on me, that the science was already there, right? Because this White House said that they were going to follow the science, they're going to follow the FDA. I didn't realize, and explain to me, is that science sound yet, or is the jury out on it?
The jury's still out, all right? If you look at the latest evidence, I mean, we don't have enough data to understand who needs a booster and who doesn't. The antibody tests that are out there, they've been around since November of last year. FDA approved them that long ago, and we still don't know, using these tests, again, quantitatively, who needs a booster. And so, you know, I think this may be a little premature to say everyone needs a booster if we follow that logic.
So just so I understand this, how long would that normally take? Like, is that something, I get you're right. I mean, all of this is still new. So in a normal course of action, would that take a year, 6 months, 5 years?
To actually understand and come up with a test? Look, I mean, if we came up with these vaccines in a matter of months, when normally it takes years and years, certainly a test such as a titer, which is what we're talking about in this case, should take a matter of months. I mean, again, FDA approved this test back in November, and we should have answers around what keeps someone safe with their titers and what doesn't. I think we got a lot more work to do, but we need to accelerate the pace for sure.
Yeah, there was a poll of over 500 doctors, and 70% of them said the evidence doesn't show that we need boosters. But let me ask you this, Dr. Harris. If this does go through and someone gets a booster who doesn't need one, what's the downside here?
Well, the downside is introducing an intervention that they didn't need in the first place, and that means you're introducing potentially some harm, right? If you're doing something that's not going to benefit you, then it's all downside, right? And we know first and foremost, as a physician, our goal is not to cause harm, and we may be introducing that harm unnecessarily to someone who doesn't need an intervention.
Okay, so again, since I'm not a doctor and you are, walk me through this. We get told that you got one and then you had to wait a few weeks to get the second. Is the point here that it's wearing off? Is that the whole goal here? Because it seems to me that if you got this and within 6 months you need a booster, that kind of calls into question the original shot you got in the first place, doesn't it? It seems like that doesn't seem like a ton of time.
You're right. I mean, if we look at the evidence, 8 months is about, on average, what we think lasts in people's system, right? But again, evidence doesn't support that across the board. Some people we know in their bone marrow have resistance for 12 months and perhaps longer. And so I think, again, instead of perhaps jumping the gun to suggest that everyone needs a booster, we should spend a little bit more time, accelerate that time, and understand who needs it and who doesn't. I mean, we're getting pushback all the time from employees saying, look, I did what I had to do to get my booster in the first place, and now my initial shot and my series, and now you're telling me I need a booster? Come on. And so we're seeing up to a third of those who already are vaccinated say, no, thank you.
Dr. Harris, appreciate your time here because it is concerning. And I know a lot of people have questions. Should I get this booster or shouldn't I? Because they're hearing information from both sides that's conflicting. So appreciate your insights.
Hey, thanks so much. Thanks for having me.
You bet.
Okay.